got a bad feeling about this.
Hi, and welcome to 933 Portland Place, your online source with a patient-to-patient view of chronic pain. Today's guest, Mr. Dennis Kinch, author, pain counselor, patient, and the man who walked 3,000 miles down Route 66 to demonstrate the power he has learned from all the patients and professionals he interviewed on the road for a solid year. This power can be found in the pages of his new book, Journey Through Pain, The Walk for Healing.
It's our ignorance. We are the providers. You know, ignorance is a disease of mankind. Are doctors people? Are nurses people? Yeah. We in ourselves bring our own belief system into the workplace as well. That makes doctors different. Not all doctors are the same. Not all people are the same.
Did you have that problem? I mean, you mentioned 4 years. I mean, when you dismissed a lot, saying it's psychological, you're working it out.
What I don't mention in my story, because I just don't like to get into the negative stuff, but I was in Colorado. I was a single dad raising 2 kids. I had what I considered to be the American dream, and I worked my way to get there. So anybody that thinks that I'm lazy, malingering, I can tell them right now, I worked 30 years to get to this point. I had a house, I had a car, I had a good job, and I was raising my kids. I worked at night so I could be there for my kids at school. I thought I was doing every single thing right that you could do. And so when I entered the medical thing with this problem in my back, I immediately started hitting the wrong avenues everywhere. My first doctor I was with for 10 months, and we did every test that you can do for this. And it even said on the test, check for Paget's disease, check for spondylitis, right on the test. He decided instead that I was a drug addict and looking for Vicodin. So he came in one day, and I swear to God, I said, I think he pulled the wrong file, because he was yelling at me, you know, demeaning me, throwing me out of his office, saying, you're not going to get your Vicodin here. And I'm like, I don't even like Vicodin, okay, but whatever. So I ended up going to another doctor. Now this doctor understood, and he apologized for that doctor, but he went on another tangent trying to prove some disease that it's called costochondritis, usually only happens to open heart patients. So he's saying to me, I said to him, have you ever thought about Paget's disease? And he goes, why would you think Paget's disease? That's so out in left field. We're thinking costochondritis. I'm thinking costochondritis is extremely rare in someone who hasn't had open heart surgery. But they'll go that way, but they won't go with Paget's, which is recommended on the test. So I went through 4 doctors like this, and in the meantime, over that time, I lost my insurance, I lost my job, I lost my house, I lost my cars, and then eventually I lost my kids. So I had to give up custody back to their mom. I actually went back to Boston to have what I thought was going to be a final surgery, an RF procedure on my facet joints. And while I was there, their mom moved to England, so my kids are in England now, and I'm homeless in Boston, going, I don't know what's going on. So yeah, I mean, I really did hit the ringer, and at that point I was blaming the doctors. To me it was the insurance company and the doctors. And
Well, it is a negative thing, and you know, I know you don't talk about it a lot, but it does happen a lot. I mean,
it does.
as young as I am, I thank you for backing me up and hearing me, because there is doctors out there that it's like you get to a point of you see, like if they didn't think of it, or they're calloused or hardened or something, that if your arm's not broken off and you don't see the morbidness, then it doesn't exist.
Yeah.
Pain is an invisible disease, and that's the hardest thing, is that it affects your lifestyle just as much as any other disease out there. But because you can't see it, because you're not wearing a cast every day, you feel like you have to prove it to everybody. And that you have to, do they really believe me? Well, maybe today, maybe I need to show that my arm isn't working, and you know, I I've had a sprained wrist and I've had it for 4 months and this pain hasn't gone away and I have trouble typing, and every once in a while I work at the National Pain Foundation and I'm believed that everybody that I work with understands what I'm going through, but there are times when I'll go in and I'll be like, oh well, I turned the knob okay this morning, I wonder if she's going to think that, if she's going to believe that I can't type today.
That's the validation
you know?
thing. You're
Right.
constantly doing things and going, ooh, I hope they don't think that. Yeah.
I never realized though, being when you are in pain and you're vulnerable and you're weak, but it's like you, just like you say, you're trying to sell them.
Yeah.
And you know, no, really, it's true. I don't need a fix, you know, just, you know, type, hear me. And then just like you say, when you have good days, you're gonna go to the max because you feel just that, you know, like that pain level's down, so you're gonna push it because you don't know what the next day holds.
But here's where education comes in, because I took a class on that. So when I say do what you can when you can, that actually comes from education. That's not just a statement of, well, I feel good today, so I'm gonna do stuff today. I feel bad tomorrow, so I'm gonna lay in bed tomorrow. Do what you can when you can implies, and I had to learn this, it implies that there's a spike, I don't know what you call it, like a graph. A good day and a bad day, and a good day and a bad day. And sometimes for me, it's a good 2 days and a bad 3 days, and a good 3 days and a bad 2 days. You know, that's usually how it works. Well, what I found out is that the way you take meds, the way you do exercise, the way you eat, all can affect these up and down curves. When I first went into therapy with the right attitude and I said to her, what am I doing wrong? The first thing she said to me is, your curves are so sharp right now. They're so sharp. Number one, are you taking your meds the right way? And I said, well, yeah, of course I am. And she goes, no, I got a feeling that you're taking less meds on a good day and more meds on a bad day. And I went, well, not real bad. But she goes, well, you got to stop that because you're creating sharp curves. You take less meds on a good day, you're going to have a worse bad day the next day. So you take double your meds that day, you're going to have a better day. See what I mean? You start this upward, downward curve, all right? Same thing with food. Well, I hurt today, so I don't feel like cooking, I don't feel like eating. So, tomorrow will be a good day, I'll eat better then. Again, you start this. Oh, maybe that's it. Damn. See, now that comes from education. So what I had to learn, believe it or not, and I think everyone in this room is going to be the same way, is that sometimes we're raised to be hard workers, put our nose to the grindstone, and that creates sharp curves. I didn't know that. Okay, so when I'm on the positive side of things and I'm listening to my therapist and she's saying, okay, I want you to do this when you walk, I want you to step. I started marching around that pool and she goes, whoa, 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 what are you doing? I said, I'm just doing what you said to do. She goes, well, you're going to hurt yourself doing it that way. You got to stop that. So when I tell you to do something, I just want you to stay at the same pace. I don't want you to increase your pace. So I thought I was doing good by taking what I'm learning and just marching it forward. And then I realized, up, down, up, down. So do what you can when you can implies that on a good day, slow down, take it easy, mellow out. On a bad day, do a little more than you think you can. You know, I don't know how many people I talked to that said, oh, yesterday was a bad day, I couldn't walk at all. And I say, did you go to the bathroom? Well, you know, of course you wanted to do that, but it wasn't easy. Well, you did. So if you took a bathroom walk as therapy, you probably did it 3 times, right? I hate to say it, but that's how I started out, was my couch 3 times a day. This is what it looked like, for real. I would hold on to the couch, and I would put on exercise shows on TV, and they're all doing this, hey, and I'm going. I'm just walking around my couch like this every day, trying to get this to move the right way, you know. But I started realizing that everything you do to move is therapy, if you look at it as therapy. So a bathroom run was therapy, cooking was therapy, and 3 times around the couch was therapy. And that built me up to doing the neighborhood. So that's how it works. So do what you can when you can implies slow the curves down. Hold up on the good days, a little more than you think you can on the bad days. But the #1 key in therapy is don't hurt yourself. That's the #1 thing. So many ways that we hurt ourselves where we don't know it. Now if you notice, I have a lot of knowledge. All right, but I've been gaining this knowledge over 2 years now of learning and learning and learning. When I go see a doctor, I like to think that I know more about me than he does. I actually know a lot about my condition, I know a lot about meds. So, now they don't like that, at least the docs I've dealt with. They immediately don't like it that I know a lot about what I'm talking about. So it kind of hits them wrong. You gotta be diplomatic about how you approach this. But when you walk in their door, you definitely want to be more knowledgeable than them about it. So that at least when they're telling you something, you know what they're talking about, you know? Kind of like with an auto mechanic. It'd be nice if you knew your car well enough that when you brought it to the mechanic, you knew at least what he was fixing. And when you know nothing about your car, man, he can change anything in there and give you a $500 bill, and you'll go, I guess. And then you drive it away and go, well, there was 500 wasted, because you know that didn't work. So you know knowledge.
Going back to your question, what has he been telling me? I mean, this guy is full of knowledge, it really is. What is knowledge? Power. He's empowered himself.
Yeah, that's what
Okay.
empowerment means.
You get on the website, read every national and global, all over the world, we teach what pain is. Pain is what the patient says it is. If a doctor disputes that, he needs to go back to school. You can teach him. You can empower him. A doc, isn't this national society says this? How can you tell me it's in my head? Pain is what I say it is.
It's almost like a key that if you need validation from anybody, then that should be a little note to yourself that you need to learn more. Because you're asking them to validate your pain, asking them to validate your disease. That's kind of a little earmark that says you don't have enough knowledge. You want to get to the point of knowledge where that doesn't mean all of a sudden they're going to validate me because I know what I'm talking about now. It just means I don't need them to validate me. You know what I'm saying? That's important.
You have to feel good about yourself. What I see in pain patients, they go to some provider. It could be a nurse, could be a pharmacist, could be a doctor, could be anybody. And they dispute, and then that really deflates the person. Sets them big time back.
Oh, yeah.
Then you really take this person's word as gospel. Well, people make mistakes. I cannot tell you how many times I make a mistake in a day's time. If you add it up, they'll fire me. You know?
Think of these mistakes too as communication between people. The uniqueness of how I hear what you're saying, and the uniqueness of how you say what I'm hearing.
Yeah.
That communication, it's a miracle we actually can communicate when you think about it.
Right.
That we're not misconstruing everything that we say. See, so that's why I really have to go to any providers much more knowledgeable about me. So when you tell me something and you say, you know, Dennis, I think you should do this, I can filter it through my filter and say, okay, what he means for me, you know. So if you find out that I walk at night, I walk overnight. I leave about 2 in the afternoon. I can sometimes walk 42 hours straight. I've done 50, okay? So now a doctor would go, that's crazy, you're gonna kill yourself, what are you doing? I just happen to know me. I know me. I would never want anyone in this room to eat the way I eat, to walk the way I walk, to sleep the way I sleep. It just works for me. I know it works for me now. And I think you can say I'm pretty healthy. You know? I sleep about 4 to 5 hours a day. That's just me. That's the way I work. And I feel great. So you have to learn this about yourself. So again, even with my disease, a doctor saying, the last thing they would think of is, why don't you go walk? That will help you a lot. That goes way against what disease I have. What they're saying is, you're walking? You know, so a lot of times, especially with any back conditions, the first thing they want to do is say, why don't you go lay down?